Good afternoon, Long Beach. Today is our briefing for October the 7th. And as always, if you speak Spanish, si hablas español, vamos a tener esta misma update después de lo que tenemos en inglés. I want to go over a few things. Like I mentioned last time, I think about 2 weeks ago, we're not going to be doing our, we started off doing these, I believe, 3 times a week. And then we went down to 2 times a week, then 1 a week. Now we're doing them as needed, just because we're having a lot of events off-site and because we're really on a much different schedule now with any reopenings or announcements really not able to be even discussed or assessed for weeks at a time with the state's new data process. And so that's why we've also slowed down the updates. But I wanted to give an overview and go over a few items. The first is I just want to say, thank you first to everybody. I really do believe that in Long Beach we are taking this pandemic seriously. Unlike in some other places, and we continue to follow the science and work with our health department and all of our partners, and we know that health is so important in our community, so just thank you, really, from all of us at the city. We're all doing our part. We have had, as of today, 12,217 residents test positive. We've also had 249, almost 250 residents pass away from COVID-19. It's a lot of our neighbors here in the community. It still is the leading cause of death in Long Beach. And I continue to hear by some that somehow the flu is more deadly than COVID-19, and that's, of course, patently false. Additionally, we've had most folks, of course, vast majority of folks recover, which is really great. I want to just begin by also reminding people that now we're entering the flu season, and we are entering a period of time where, because of cold weather, people get colds, people get the flu. I had my flu shot just yesterday, and I encourage everyone to please get their flu shot. There are free clinics. You can see those online. We have some of those clinics at longbeach.gov, but they're all across the city. It's important that, especially this year, that everyone gets the flu shot because we don't need folks to get sick, think they have COVID, fill up our COVID testing sites. It's just going to be, it would add to a lot of issues, and you're more vulnerable also when you're sick. I want to start by just sharing my disappointment and the city's disappointment in the real just breaking down of talks between the White House and the Congress over the stimulus and COVID-19 package. For the last few weeks and months, myself, along with mayors across the country and members of Congress and others, have been working on pushing a strong stimulus package for COVID-19 that would provide direct relief and support to cities, to states, to hospitals, to schools, to small businesses, and directly back into residents so that we receive additional stimulus and extending those unemployment benefits. Unfortunately, after weeks of progress, where we thought we had an agreement between the Congress, the Senate, and the House and the Senate, both sides, the President weighed in yesterday and just decided to end any talks and that we would not have any more additional COVID-19 stimulus. So it's very disappointing that that happened. What does that mean for Long Beach? We worked to ensure that we would get substantial support in the package. We would have seen about $180 million of support in that stimulus package. So what would that have meant to us here locally? It would have meant restoring critical city services that were cut in this last budget. It would have rolled back employee furloughs. It would have created an enormous grants and loan program for restaurants and bars and all businesses across the city. It would have been additional grants for the arts and cultural programs. It would have been assistance to low-income families for food, for rent, for diapers for their children. It would have been more homeless shelters, more programs for people experiencing homelessness so that they were off the streets and into their homes. It would have meant more broadly and more strategic testing opportunities, more PPE for our local clinics. It would have also meant direct financial assistance to all of you watching that are struggling and that need that direct support from not just federal government, but also from the city. It would have meant money to make our schools in Long Beach safer so that when we are ready to reopen, they would have the PPE, the supplies, and the ventilation systems to open appropriately. Would have been more support for our hospitals so that they have the capacity to take on any additional surges or future pandemics. And it would have meant an extension of unemployment benefits for those that are struggling right now and looking for work. So quite simply, for Long Beach, it would have been an opportunity to rebound through this real recession that the country and our city is going through right now. And it's really a shame and, quite frankly, disgraceful that that the president decided to end those talks. We don't support that position. And we're hopeful that those talks resume. And we encourage the president and the Congress to start those talks again. Now I want to talk a little bit about what we've done as far as the local economy here in Long Beach. We know that the state has a new blueprint on how we move forward. LA County, which includes Long Beach, continues to remain in the purple category, which is the most restrictive tier and the most widespread category. And while we continue to do much better than we were a month, 2, 3, or 4 months ago, we're still, from a statewide perspective, have a lot of work to do. Dr. Davis is going to talk a little bit about some of the new health equity standards within those tiers. Now, in Long Beach, we are working also to address health disparities, particularly within communities of color that we know are more greatly affected here locally, but across the state. We've launched clinics for immigrant communities and communities that speak other languages besides English, and those continue, and we're really proud of those. And of course, we are slowly reopening parts of the economy to ensure safety. That includes nail salons, which can now open at a limited capacity, as we all know, like barbershops can. We've opened up some of our playgrounds at our parks. And we've continued to work with pubs, breweries, and local bars so that they can operate as restaurants. It's important to note that bars are closed in Long Beach. They continue to remain closed. But if a bar can convert to a restaurant format and partner with a local food service, then in that case, you can go through a process to reopen, of course, with all the same rules as a restaurant, which is dining outside, sitting at a table, all of the same exact rules. So that continues. And the last piece is we've also begun accepting some limited amount of waivers for schools from K through 2. So really just that limited amount, kindergarten through the second grade. And just to be clear, this is exactly the same that the county has done. So the county has kind of set this up for all the school districts in the county, and Long Beach is a part of that. We have our own school district, of course. But just as you're aware, as of today, and I just spoke with our health director, the city has no waivers that have been requested by any schools. We do expect that we may get a couple applications. Of course, there's an application process that's quite rigorous. And if we receive those applications in the next few days, we will look at those. Our health department will look at those waivers. But it will be limited in nature. And in addition to that, we are very cautious to ensure that safety is in place for everyone. And we want to make sure that our students, but our teachers and everyone else remain safe. So that is where the county is at. LA County will not be even looking or discussing any additional changes until the health data is better, and that's per the state. So we have, at a minimum, 2 additional weeks before we can even contemplate any changes to the health order, unless something changes from the state. So for the next 2 weeks, kind of where we are today is where we're going to remain. There won't be any additional openings per the state and LA County unless somehow something dramatic changes at the state level. And lastly, as I turn this over to Dr. Davis, I just want to remind everyone to please do your census. If you have not filled it out, if you're watching this and you have not filled out your census, go fill it out right now. It's my2020census.gov. We really need your support. So thank you, and I'm going to turn this over to Dr. Davis.
Thank you, Mayor. Good afternoon. So I will start by going over the health equity metric. As Mayor Garcia mentioned, yesterday the state added a third metric in determining whether a county could move to the next tier. So now, in addition to the case rate and positivity, counties must meet an equity metric that's designed to address the disproportionate case rate of COVID-19 among certain populations. So we know that some communities are impacted by COVID-19 differently than others. And the health equity metric is put in place to ensure that the individuals most affected by the pandemic are doing well enough that moving the entire county to the next tier is safe for everyone. The equity metric is based on factors that we in public health know impact health disparities. So we call these conditions social determinants of health, or in the case of this metric, they're called health equity indicators. And these indicators include things like economic factors, things such as median income, social factors, educational factors, the highest level of education attained in a household, for instance, transportation, housing factors, and environmental factors. And in order for a county as a whole to move to a less restrictive tier, these areas in our community that are most affected by these health equity indicators need to be at a certain positivity threshold. And so far, Los Angeles County is meeting this metric. And to make sure that we continue marching towards this goal, we will continue to expand our testing through our mobile testing program. And we're also utilizing our CARE funding our CARES Act funding to fund nonprofit organizations in Long Beach who service communities most impacted by COVID to provide education, outreach, and connection to testing and other services. The request for proposals is out right now for these services, and more information can be found on Planet Bids. Now I'm going to discuss flu testing. Another method we'll start using to reduce the burden of this pandemic in our community is at our community COVID test sites, we will also start testing for flu as well as COVID-19. And we can do that at the same time with the same sample. So you give the same sample, but now instead of just getting a COVID-19 test, starting pretty soon, that sample is going to be tested for flu and COVID-19. This way, everyone being tested for COVID-19 can also find out if they're infected with the flu. And this is really important because the symptoms of COVID-19 and the flu can be very similar, and the flu season is right around the corner. It's especially important this year for everyone who can to get their flu shot. And we'll be offering additional drive-through flu vaccine events now through November 21st. On Thursdays from 3 p.m. to 6 p.m. at Veterans Stadium, and on Saturdays from 10 a.m. to 1 p.m. at Cabrillo High School, free of charge. So now to turn to the school waiver process. Public and private schools, as the mayor mentioned, public and private schools through grade 12 were already permitted to provide limited in-person instruction for students with disabilities, English learners, at-risk students, and high-need students. Last week, we announced that we'll align with Los Angeles County and allow schools to apply for waivers in order to reopen schools for in-person instruction for transitional kindergarten through second grade. While Los Angeles County remains in the most restrictive tier, schools may have the opportunity to bring back students by demonstrating the ability to put measures in place to limit infection and respond effectively if and when a student, faculty, or staff tests positive. The waiver process is currently available for students and schools from transitional kindergarten through second grade. In order to grant a waiver, the health department will require adherence to the Los Angeles County school reopening protocols. There must be sufficient and appropriate protective equipment and infection control supplies for all teachers and staff, as defined by the protocol and the state guidance. Schools must also have a defined plan for investigations, and outbreak response and contact training also needs to be completed. Schools must assure that testing resources are available to provide access to periodic testing to all teachers and staff with a reasonable turnaround time. Waivers must be submitted electronically on our website and must include letters of support from labor unions, organizations supporting teachers and staff, and parent organizations. Schools with higher percentages of students qualifying for free or reduced priced meals will be prioritized in the waiver application process. And waiver decisions will be made after consultation with the state per their requirements. And we plan to align with Los Angeles County in having a staggered, phased-in approach to school reopenings as well. This information will also be posted publicly on the Health Department's website. The waiver application, reopening protocols, forms, instructions, and other resources are available at www.longbeach.gov/COVID-19 EDU. And with that, I'll close for questions.
Thank you, Dr. Davis. We will now take questions from the media. We have a question from Valerie at the Long Beach Post. Go ahead, Valerie.
Hey there. So this sounds like it's going to be just like LA County's process. Are you guys going to have like a limit for the number of schools that you're allowing to apply for waivers or accept waivers each week like LA County?
Thank you. So right now, the plan is to have a staggered, phased-in approach. Just because of the fact that we don't have the same vast number of schools that LA County has, we haven't put like a set limit. But if we get like this huge influx of applications, we're not going to just open every single one of those schools. It will be phased in and staggered. So we just haven't put like an exact number limit, but we are planning to align with a limited number of schools at a time to allow reopening.
Thank you, and that ends media questions. We will now move on to Spanish interpretation.
Muy buenas tardes, gracias por acompañarnos. Hoy es el comunicado de prensa para hoy, miércoles 7 de octubre del 2020. Continuamos tomando esta pandemia en serio y seguimos los datos, la ciencia y los consejos de profesionales de la salud pública capacitados a medida que respondemos a esta crisis para proteger la salud de todos en nuestra comunidad. A la fecha, 12,217 residentes han dado positivo por COVID-19 en la ciudad de Long Beach. Y el alcalde también quería mencionar, bueno, déjeme seguir con, lamentablemente hemos perdido 249 residentes de Long Beach a causa de COVID-19. El alcalde mencionó que por favor asegúrense que ahora que ya viene el invierno y el tiempo para la gripe va a empezar, que recomendamos que por favor vayan y agarren su vacuna para la gripe. El alcalde también quiso mencionar que desafortunadamente el paquete de estímulo de casi 180 millones de dólares para la ciudad ha sido puesta en pausa, ya que el presidente terminó la conversación para ese estímulo que asistiría a negocios pequeños, restaurantes y también a la comunidad para servicios como pañales, comida, hospitales, equipo médico para los hospitales y centros médicos aquí de la ciudad y sobre todo asistencia para todos ustedes, los residentes. Esperamos que esa conversación con el presidente vuelva a la mesa y tengamos una solución para ese estímulo que la ciudad necesita. Como usted sabe, el plan para una economía más segura del Estado se utiliza para determinar las operaciones y rastrear las tendencias de COVID-19. Los condados se asignan a niveles según dos criterios principales: la tasa de positividad de 7 días y los casos diarios nuevos por cada 100,000 personas. El condado de Los Ángeles, que incluye a Long Beach y Pasadena, permanece en el nivel morado, que es el nivel más restrictivo. Ayer el Estado introdujo una nueva métrica, aparte de esas dos que mencioné, que es una métrica de equidad en salud que incentiva a los condados a reducir las infecciones en todos los vecindarios. Como sabemos, hay muchas comunidades que han sido más afectadas que otras por la pandemia. Voy a hablar sobre esto en más detalle en unos momentos. Tenemos unas buenas noticias. Los funcionarios de salud de Long Beach actualizaron recientemente la orden de salud para alinearnos con las pautas del nivel morado del estado y del condado. Esto permitirá una mayor reapertura de algunas industrias y servicios. La orden de salud actualizada entró en vigencia este lunes 5 de octubre y se aplica a los salones de uñas, patios de recreo y equipos de acondicionamiento físico al aire libre y bares, cervecerías, cantinas, entre otras que empezaron la vigencia el lunes. El Departamento de Salud también emitió protocolos actualizados con detalles para los operadores y visitantes de estos espacios recientemente abiertos. Como hemos mencionado, los salones de uñas pueden abrir a un máximo del 25% de su capacidad si siguen esos protocolos de seguridad. Otros negocios de aseo personal, como los servicios de spa, incluyendo masajes, tratamientos faciales y depilación, siguen estando prohibidos. Los patios de recreo al aire libre administrados por la ciudad y los equipos de gimnasia al aire libre, que también son operados aquí por la ciudad de Long Beach, pueden abrir con protocolos de seguridad establecidos. Pueden visitar nuestra página de web para agarrar esos detalles y ahorita en un momento le doy esa página. Se requiere la supervisión de un adulto en los patios de recreo para garantizar que se cumplan esas reglas ahora que se van a abrir en los parques, y los bares, cantinas y cervecerías que no tengan un permiso de restaurante de la ciudad pueden operar al aire libre solo bajo las siguientes condiciones. Primero, un proveedor de alimentos tradicional como un restaurante o un camión de comida que ofrecerá comidas para sentarse y cenar. Además, los bares necesitarán un permiso temporal que serán dado por la ciudad o por el estado antes de operar. Cualquier pedido de alcohol debe estar en la misma transacción de una comida auténtica, y las personas deben pedir una comida o un alimento antes para poder beber una bebida alcohólica. Quiero recordarle que nuestro sitio de web de la ciudad tiene una gran cantidad de información y les recordamos que pueden visitar a www.longbeach.gov/COVID-19 para conocer más detalles sobre la orden de salud más seguro en casa, los protocolos de seguridad y más de los cual acabo de hablar. El censo. Se ha dado una extensión para el plazo del censo, pero por favor no espere. Complete su censo hoy si no lo ha hecho ya. Los resultados de este censo ayudan a determinar cómo nuestra comunidad recibe dinero para servicios de emergencias, hospitales, educación e infraestructura. Es fundamental que obtengamos un recuento completo para poder recibir nuestra parte justa de los fondos para estos servicios importantes. Por favor, visite www.my2020census.gov o también puede llamar al 844-330-2020 para completar ese formulario y ser contado. Ayer el Estado agregó una tercera métrica que mencioné anteriormente para determinar si un condado podría pasar al siguiente nivel. Mencioné anteriormente que seguimos en el nivel más restrictivo, en el nivel morado. Ahora, además de la tasa de casos de positividad y la positividad, los condados deben cumplir con una métrica de equidad diseñada para abordar la tasa de casos desproporcionada de COVID-19 entre ciertas poblaciones. Sabemos que las comunidades latinas o de bajos recursos han sido afectados más que otras comunidades. La métrica de equidad en la salud asegura que las personas más afectadas por la pandemia estén lo suficiente bien como para que el traslado de todo el condado al siguiente nivel sea seguro para todos. La métrica de equidad se basa en factores que en la salud pública sabemos que afectan las disparidades en la salud. Llamamos a estas condiciones determinantes sociales de la salud o en este caso de esta métrica, indicadores de equidad en salud. Estos indicadores incluyen factores económicos, sociales, educativos, de transporte, de vivienda y ambientales. Para pasar a un nivel menos restrictivo, estas áreas de nuestra comunidad deben estar en un cierto umbral de positividad. El condado de Los Ángeles, incluyendo a Long Beach, está muy bien encaminado para cumplir con esta métrica. Estaremos también agregando 3 pruebas móviles más a la que ya está trabajando. Para asegurarnos de que seguimos avanzando hasta este objetivo, ampliaremos el acceso a las pruebas a través de nuestro programa de pruebas móviles y como mencioné, están agregando 3 más a este programa. Pruebas de COVID-19 ahora incluye prueba para la gripe, entre otro método que comenzaremos para usar para reducir la carga pandémica para todas las poblaciones, es que los sitios de prueba de COVID de nuestra comunidad también realizarán pruebas para el virus de la influenza o gripe. Cada prueba se analizará para detectar el coronavirus o COVID-19 y la gripa al mismo tiempo. Como sabemos, la gripa puede también traer muchos de los mismos síntomas que COVID-19. Entonces queremos asegurar que estemos sabiendo qué es con lo que usted se está enfermando. Este año especialmente es importante que todas las personas reciban la vacuna contra la gripa, como mencioné anteriormente. Ofreceremos eventos adicionales sobre la vacunación contra la influenza o la gripe desde ahora hasta el 21 de noviembre. Este será los jueves de 3 a 6 de la tarde en Veterans Stadium y los sábados de 10 a 1 de la tarde en Cabrillo High School. Voy a repetir esto. Entonces, los jueves de 3 de la tarde a 6 de la tarde se ofrecerá la vacunación contra la influenza en Veterans Stadium y los sábados de 10 de la mañana a 1 de la tarde en Cabrillo High School. Esta tarde también quiero hablar sobre la reapertura de escuelas y el proceso de exención escolar. A las escuelas públicas y privadas hasta el grado 12 ya se les permitió brindar instrucción limitada en persona para estudiantes con discapacidades, estudiantes estudiando inglés, estudiantes en riesgo y estudiantes con grandes necesidades. Pero la semana pasada se anunció que nos alinearemos con el condado de Los Ángeles y vamos a permitir que las escuelas soliciten exenciones para poder reabrir las escuelas para recibir instrucción en persona desde preescolar hasta segundo grado. Aunque el condado de Los Ángeles permanece en el nivel más restrictivo, las escuelas pueden tener la oportunidad de traer de regreso a los estudiantes, demostrando la capacidad de implementar medidas para limitar la infección y responder de manera efectiva si un estudiante o un personal da positivo. El proceso de exención está disponible actualmente para los estudiantes desde el jardín de infancia, es preescolar, hasta el segundo grado. Para otorgar una exención, el Departamento de Salud requerirá el cumplimiento de los protocolos de reapertura de escuelas del condado de Los Ángeles. Mencioné que estamos alineándonos con los mismos requisitos que el condado. Debe haber equipos de protección y suministros de control de infecciones suficientes y apropiadas para todos los maestros y el personal, según lo definido por los protocolos y la guía estatal. Las escuelas también deben tener un plan definido para las investigaciones y completar la capacitación en respuesta a cualquier brote o rastreo de contactos por si alguien sale positivo. Las escuelas deben asegurarse de que recursos para las pruebas estén disponibles, dando acceso a todos los maestros y el personal con tiempos de respuesta razonables. Las exenciones deben enviarse electrónicamente en nuestro sitio de web y deben incluir cartas de apoyo de sindicatos, organizaciones que apoyan a los maestros y el personal y las organizaciones de los padres. Se dará prioridad para esas exenciones a las escuelas con más alto porcentaje de estudiantes que califican para recibir alimentos gratis o de precio reducido. Las decisiones de exención se tomarán después de consultar con el Estado según los requisitos que ellos han puesto. Esta información también se publicará en el sitio de web del Departamento de Salud. Puede visitarlo en www.longbbeach.gov/COVID-19 EDU para educación, EDU. Por último, quiero compartir información sobre una oportunidad para las organizaciones sin fines de lucros y también con fines de lucro para fondos para brindar servicios de apoyo a la comunidad. A través de los fondos de la ley CARES que fueron recibidos del Estado este verano, ahora se publica una solicitud de propuestas solicitando agencias que pueden ofrecer servicios de salud mental que incluyen asesoramiento, vales de vivienda, de emergencia, asistencia para víctimas y sobrevivientes de violencia doméstica, gestión de casos y asistencia telefónica a través del Long Beach Resource Line, servicios de apoyo para adultos mayores, entre otros. La solicitud de propuestas estará abierta ahora y hasta a las 11:59 de la noche el 18 de octubre. Los detalles relacionados con el alcance, la elegibilidad y las instrucciones de envío están disponibles a través de Planet Bids, al que se puede acceder en el sitio de web de nuestra ciudad en longbeach.gov. Otra vez, cualquier información de la cual hemos hablado hoy puede visitar nuestro sitio de web en www.longbeach.gov para cualquiera de los temas que hemos cubierto hoy. Esto es todo por hoy. Muchas gracias por acompañarnos. That is all for today. We thank you for joining us.